Are we being streamed?
Yes.
And we're being streamed live on Facebook. So, as I mentioned, it feels as though we're experiencing a Rip Van Winkle moment. But with a clean slate, we begin our 2023-24 perspective session with an intriguing look. Let's see, do we have everybody here? Dr. Seay.
I'm here.
Where are you? Oh, there you are. With an intriguing look at innovative Robert Wood Johnson Foundation grant that we're honored to receive. It is a community-based study approach catalytically improving the health status and outcomes in our community, and could very likely, and I might say would very likely, serve as a national model. However, as always, let's dispense with governance and business items that need action. The draft July meeting minutes, seems like forever ago, have been distributed. Are there any corrections or edits? Cool. If not, the chair will entertain a motion to approve those minutes.
So moved.
Second. Any opposed? Now, I think we will have an engaging and interactive conversation with the chairman of the Sociology Department at Simmons College. We're honored to have Dr. Nancy Seay. In collaboration with U of L School of Medicine, the Christina Brown Environment Institute, Dr. Seay is a renowned academic sociologist who's the principal investigator researcher for this RWJF grant. She's working with Ted Smith, Assistant Director of U of L School of Medicine's Environment Institute. Joining them are Michael Emerson of Rice University and Shivani Carthens of the University of Kentucky. The grant, entitled Creating a Universal Basic Neighborhood, is essentially a data-driven model that leads to breaking down the community barriers in a neighborhood in order to demonstrably achieve health equity. It's slated to identify community neighborhood assets that are more conducive to healthy living and which ultimately lead to better health outcomes. The assets are determined through the work of residents in the selected neighborhoods. As you know, most determinants of healthcare are determined on an individual by individual basis. This takes a look at the entire community, which those, or the neighborhoods in which those people live. To discuss this study, which focuses on 2 neighborhoods, it's my privilege to yield the floor to Dr. Seay. Welcome.
Good morning, everyone, and I trust you all had your coffee. I have.
Excellent.
This is something that is really, really close to my heart. That Ted Smith and I are doing, along with many collaborators. We know the correlation between neighborhood and health outcomes. It's
1 second. Do we have the PowerPoint?
We printed the PowerPoint out for
Yes.
everyone,
Okay.
so that because we had technical issues.
Okay. Very good. Thank you.
We know that the correlation between neighborhood and health is pretty well stated. We know that, right? Yet, think about it, for health measures, say obesity, okay? Even though we see different rates of obesity by neighborhood, if I come to the doctor's still going to tell me, lose weight, right? Get exercise, eat right. And, you know, if my case is a little bit more difficult, the doctor may tell me, you need to get on medication or even have a type surgery. So we're looking at trends in neighborhoods, and yet we're treating individuals. And with all of these options, we're still losing the battle with obesity, right? Especially among Black folks here in Louisville. We're nearly 3 out of 4 Black residents of Louisville are categorized as obese. We think it's time to do something different. It's time to look at healthcare differently. It's time to change the way we address healthcare.
Dr. Seay, she does have a slide up, so just say next slide, and she'll slide for you, okay?
Okay. You're great there. The universal basic, and I'm going to add healthy neighborhood. The universal basic health, neighborhood was inspired by universal basic income, which we've all kind of heard of. It's taken, had a lot of traction in the United States. It's not a new idea, right? We even have, I think, a pilot here in Louisville. Well, that universal basic income says that every individual should have a cash type of distribution, no matter who you are or what your status is. We've seen this in other countries and what have you. Well, we're saying in the same way that every neighborhood should have a universal basic level of resources that enables people to live healthy lives, to live healthy lives. Next, please. Next slide, please. Okay, here's conceptual framework, and as you can see here, we know that some neighborhoods are not healthy neighborhoods. And then some neighborhoods have access, and we would say are over resourced sometimes. But what we're looking at is what are those basic things that need to be in a neighborhood for the people in that neighborhood to live well. This conceptual framework suggests that communities across the country should debate and resolve to identify their threshold mixture of health limiting and health promoting factors. So we acknowledge that what a universal basic neighborhood looks like can change from neighborhood to neighborhood. And that's we can't just say this is what it takes for every neighborhood any more than we can say this is what it takes for every individual. But it's up to neighborhoods to kind of figure that out. However, we want to give a basic set of tools to help neighborhoods understand what we need and the degree to which they need to add to the resources or enhance the resources that are already present. Next slide, please. We have some basic assumptions. All communities have assets that support health outcomes. We just have to find out what they are. And that's part of what we're doing with this study. Is finding those health outcomes. We are, what sets our study aside is that we're coming from a strength-based perspective. We already know what's wrong with many of our communities, right? We've done needs assessments, we've done all sorts of things. But now we need to begin to understand what do communities already have in place. Also, we understand individual behaviors. They're a product of complex environmental and interpersonal conditions. So we're really not considering that individual perspective right now. We're looking for neighborhoods. And we know that there's a threshold for a universal a baseline exists. We're assuming that there's a baseline of resources that need to be in every community. We just have to figure out what they are. And then in this, we have to consider the barriers, group impact, and clustered interventions, not just the single, hit and miss. But what can we do? These integrated clustered interventions that will cause communities to thrive. And then we acknowledge that there's an analysis gap between the current state versus desired state and civic investment versus structural equity. That's one of the reasons why we're doing some of the activities, which we'll get to later. And then finally, we want to come up with proposed model legislation that can be used across the nation for urban areas for addressing health equity issues, along with possible interventions. Next slide, please. The Universal Basic Neighborhood is a Robert Wood Johnson funded study and a collaborative effort between Simmons College of Kentucky, Louisville's only HBCU, and the University of Louisville. Also, we are collaborating contributions from researchers at the University of Kentucky, Rice University in Texas, and all of these we're using to investigate neighborhoods. We're investigating factors that drive health outcomes and vulnerabilities, with the goal of developing an understanding of baseline essentials that are needed in every single neighborhood to support the health of the residents of that neighborhood. And to do this, we're engaging in 5 major activities on this study. And this is kind of exciting. And let's go to the next slide, please. Okay, the team at U of L are performing a major literature review of all health-related factors and frameworks associated with places to develop a baseline framework. And I mean, this work is really extensive. We're looking at everything in the literature there. And now, well, first the objective, to get that baseline framework And how are they doing it? First, they're identifying frameworks. And you have in the next slide your just a little idea of some of the frameworks that they've already investigated. And they're finding a lot. And then once they've identified the framework, they're reviewing it and they're doing coding these frameworks, coding the outcomes and the different things that they come up with. And from that, they're extracting factors for that are associated with health and neighborhood level. And then they're developing a factor list. Now, the next slide, please. You might not have this in your packet. Okay, that was the extra one. And our friends at Val said, no, we want the people to see exactly, what this looks like. And so this factor concept map shows how they're working to expand and make sense of the 24 ranked measures and 52 additional measures suggested by that framework. And the concept map kind of shows how each is connected to that. In the middle, that's universal basic neighborhood, and how each of these factors are connected and where they fit in. To try to come up with this baseline, but will also be informed by other parts of the study as we continue to dig deeper. Next slide, please. Okay, the second activity, and this is performed by Councilman Jafori Arthur, is that he's looking at and evaluating 25 years of Metro Louisville neighborhood plans. What he's looking to see is the degree to which these plans have actually been implemented. And he's doing it by also digging deep into city funding to see where the money has gone over these years. And that's how he's assessing whether the recommendations of these neighborhood plans have actually been implemented, by how much investment has been put towards it. And we recognize that this is a difficult thing because, say, I know Preston Hill just had a new neighborhood plan that they just developed. And so we look at that, I don't anticipate we're going to see any investment, right? Because it just, within the last month or so came out. But these older ones, you would expect to see some investment, right? And so it's also weighing the time that neighborhood plan has been in existence. And so this is a fairly complicated thing, but we really want to look at it because then that's going to help us to know how neighborhoods have been invested in versus what has not seen civic investment despite the recommendation of the city plans. Next slide, please. The third activity performed by Shivani Carthens, a legal scholar at the University of Kentucky, is to conduct a legal policy, a legal and policy review. And we recognize that change at this level requires sound policy development. We're not there yet. That's what we want to come up with. However, Professor Carthens is focusing on housing, education, employment, planning and city engagement, as well as food systems. But there's other considerations that she's also looking at, and she's leaving no rock unturned. Here's a funny one. Did you know that police are enforcing health laws? Now, of course, we know this is a blatant function of policing, right? But think about it. Police are enforcing whether you are using your cell phone while driving, whether you're wearing seatbelts, whether you're obeying speeding laws. All of this contributes to health. And so that's what I'm finding with what Professor Carthens is doing is so innovative, that she's looking at it from so many different angles. And then how does policies come together? While she's focusing on local policy, she's looking at policy at every level. The next slide, please. And Heidi asked me for a projected, for some ideas about policy. And Shivani says, well, we don't have it yet, but here's what we're looking for. And our broad focus for health-related policy considerations. And so there is a direction that she's going in. Next slide, please. Now, this is why I was brought into the study, because of the work that we've been doing with Louisville's Black asset mapping. During the uprisings in 2020, my president came to me, Dr. Kevin Cosby, and he says, Nancy, I want you to start looking at neighborhoods and looking at neighborhoods from a strength-based perspective. And he kind of threw me in there, but I'm up for a challenge. And I gathered the students together, Councilman Corey Arthur and myself, and we began to look at how we can uncover assets in neighborhoods. Now, he used some of his background as a politician. He says, why can't we just canvass the neighborhoods? Ask him just a few questions to get an idea of what the neighborhoods value, what's valued in the neighborhood. So we did this pilot study you have of Parkland neighborhood, funded by the Harshaw Foundation. And we used what we had and we went out into the neighborhoods. And even in spite of the fact that it was during a pandemic, we were able to gather all sorts of wonderful information and find out things about the Parkland neighborhood. And then because of Councilman Arthur sitting, on city council, he was able to directly speak to the city council about the needs of this one particular neighborhood. This is our third time, and we're really excited to do really thorough asset mapping of the California neighborhood and the Crescent Hill neighborhood here in Louisville, Kentucky. That's a picture of some of our students. I think that was 2021 or 22 when they were going out doing asset mapping in the Limerick neighborhood, where Simmons College of Kentucky is located. One thing we really believe that those who are closest to a situation are the best ones to inform that situation, whether we're talking about problems in a community or getting underneath what the community already has to strengthen it. One thing that we're also looking at in communities, and I really like this, we're looking for future assets, that's what we call them, but what are the potentials in a community that can be developed? And so we're looking at what the people in the community really, really value in their communities. And then we're looking at things in that community that can be developed. And this time we're looking at two comparative communities. And I really kind of like that. At first, I was a little bit resistant to the idea because we were originally assigned to develop a Black asset map. But this idea of comparing the two communities really helps us to understand the differences in communities and how communities mobilize to take action. And it might be different in one community than in another. And so I really like that. I think our next time we might do a comparative study as we move on to the next community in Louisville.
And I believe you're asking.
Yes.
To neighborhoods in order to select next to. So if let us know about suggestions, neighborhoods, it's quite welcome. And this, I think, has some real opportunity as a model, not only but across the country, and gives us something positive in terms of system change.
Thank you. And the next slide, our final activity is to conduct a comparative analysis. Sociologist and author Dr. Michael Emerson of Rice University is conducting a comparative analysis of these two neighborhoods. California neighborhood in the area we call West Louisville, and Crescent Hill neighborhood in the area we call East Louisville. And we're actually doing case studies of both neighborhoods. And it's going to include all of the information combined that we come up with to really look at how these neighborhoods are different and weigh how these neighborhoods really can even conceptualize what is health. We admit that this could be different by neighborhood. With these 5 activities, while these 5 activities span academic disciplines, they are also interconnected. And we're finding interdependent with findings that we're going to somehow merge together. Can you imagine that from across the board here? To produce the qualities and resources that would make up a universal basic neighborhood. Next slide. And these are team members, and you have that there. We don't have to go through all of it, but I would like to, the support staff that we have. And U of L, graduate research assistants, the Social 304 class at Simmons College of Kentucky, and that's kind of interesting. You might want to know. It's the class that's being taught by Councilman Arthur. And we are including people from U of L, students from U of L, students from Simmons College of Kentucky, neighborhood residents that we're also including in this class to train them as data collectors, but also we need neighborhood residents to inform the data collection. This is truly participatory action research that we're performing within the neighborhoods as we do the asset mapping. And finally, last slide. Let's change the conversation about health. Let's look at health women. And Heidi told me she didn't like to schmooze, but I'm a big schmoozer. And I've got something for you. All of our students are going to, our data collectors and our team members, or the old this thing up here, are going to get this beautiful t-shirt. Well, do the best I can. And I'm going to give this to Heidi. I think I'm going to have to get a different.
Your workout. That's where we're going to.
I might have to get you a different size. I didn't have all in there. That's how we're going to identify our students and our research assistants as they go into the neighborhoods. We want everybody to know they're with the UVN study. I hope I didn't leave anything out. I bowed to my colleague, Ted Smith. Thank you very
About
much.
the questions, but, as the board knows, I am, a huge proponent of touting those, opportunities to get positive spread of what Louisville is doing. As we've discussed, this has the opportunity to be a national model. So the results of this in publishing the results becomes something pretty critical. So that's the only piece I would leave you with, but I will, and clearly, if there are any health policy related recommendations, this board has been wonderful in supporting those and approving it. All one has to do is to write it up, we'll consider it and pass it. And then what we do is to release it as a statement of the Board of Health. So, board, open to your questions.
I have a question.
Yes.
And it goes back to the universal basic income. I do remember that pilot. What is the location for the pilot?
Was it Russell?
I believe so. It was through, I think, Medford United Way.
Well, of course, I think of money as an asset as well, and it would be interesting to see how that might correlate with universal basic neighborhood. Because there's interest, of course, in UBI also. And it might be able to support some of the things that you're looking at for a healthy neighborhood.
Oh, I agree wholeheartedly. UBI though tends to be like an individual intervention,
Absolutely.
and I mean, UBI spread across the neighborhood, a neighborhood intervention, but we're really looking at some of those more broad areas as well. But I agree wholeheartedly.
I just thought it would be interesting if there were an overlap to see how it affected
Yeah.
the institutions that you're talking about. Do people buy more produce?
The issue too on UBI is to ensure that it's sustainable and not a handout. And I'm one of those people who believes that any incentive that we give people needs to be both carrot and stick. And there's something in return that the person has to offer up to ensure that it's sustainable, because it's helpful to people, but when it stops, that's my concern with ARPA monies, is that those go away. So does all of the projects, programs, initiatives that were started as a result. So believe that as well.
And I believe that, yes.
Just a break for both of you, Dr. Seay, Dr. Smith. Got a quick question for you. If I understand correctly, that your study has a little twist, which is you're looking for what are the strengths in those neighborhoods rather than the typical or the usual studies that we're so used to seeing what's lacking. So you're looking at, okay, what are the concrete and pillars there that you can build around to create those universal basic neighborhoods? Am I correct in?
Absolutely.
That's wonderful.
Yeah, the problem with the needs-based approach is often it's people coming in from the outside, they're deciding what this neighborhood needs. And, you know, we're all highly educated people and have our ideas about what it takes. But we really don't fully know, do we? So we have to go to the neighborhoods and ask the people. And we can plan a wonderful intervention, but if it's not what the neighborhood wants, then how well will the intervention work? And the other thing is, when it comes from neighborhoods, it increases the chances of sustainability. You know, I've been been part of interventions, and when the government changes. When we get a new government, the money dries up. And might have been a good intervention. And so we are looking, just like for the sustainability that you're looking for the UBI, it has to be the same thing for a universal basic neighborhood. And that's why we have to have legislation in place. And we hope to bring up that model of legislation that will enshrine these universal basic neighborhood qualities in law.
Yes, ma'am. So help me better understand the scope. I understand you were in Parkland, California, Crescent Hill in terms of comparison. So is this metro, like help me understand what the full scope is in terms of study?
Okay, for me, my original ask was to asset at all of the Black communities in Louisville. And we're doing it one community at a time. But for this study, we're not on the communities for comparative purposes, and we see the value in that. We're considering continuing that way. And Ted has made me a believer in this idea of universal basic neighborhood. And universal basic neighborhood, what I like about that is we're looking at all neighborhoods. And sometimes some of the things that we would even see as resources, say perhaps in a neighborhood that's over-resourced, is it still an asset? You know, if you have too much of a good thing, it's still an asset. You know, right here in this section of town, but we have what, 3-4 hospitals. Now, maybe I'm talking to the wrong people, but we have like 4 hospitals here and no hospitals in our very few hospitals. One hospital is not local. And finally, we're getting a hospital, West Louisville. Well, having all of these hospitals in this one place, is that really an asset?
Yeah, so I think just as a follow-up to that, that's a really good question. You know, what I'm wondering, for some of the neighborhoods I know that are most in need, they don't have a neighborhood plan. So using that as the basis, there is no neighborhood plan, for instance, for Southside. Iroquois has no neighborhood plan. And so there's no basis in which to even look to see, did what the neighbors want and identify as needs align with financial investments? And so I'm super interested in all of this, and want to commend you for being able to devote not only interest in study, but also I can't wait to see the policy considerations.
Okay, thank you. As Nicole knows, I am partial to South End being appropriately resourced, and because it over the years has been neglected by Eastburg. So commend the outreach on that, and Deputy Mayor is a great resource for that. Other questions?
I do have just one. So for this survey that the students conducted when we're in these neighborhoods and talking to the community, what kind of does that look like? Is it just a questionnaire? Are you giving them the option to say, like, what kind of things do you want in your neighborhood? Because I know, at least for me, you know, if I'd never been out to, say, maybe Norton Commons or Crescent Hill, I might not even think about walkability. I may be aware that I live in a food desert, but I might not go that extra mile and say, not only would I like a convenient and affordable grocery store, but I'd like to be able to walk to it. So what does that survey kind of look like? I just am curious, like, what options are we giving them to fill out?
Is there a sample survey?
Or, yeah.
I don't have it with me now,
That's okay.
but what we're sticking with, we're sticking with 10 questions, right? Because we don't want to take up people's time. And the questions we'll ask are kind of like, what do you use in your neighborhood? Who do you go to for health advice? One thing that now, that we have this grant that we're able to do is student follow-up. And we're gonna do the follow-up groups based on what we find this fall in the surveys. Then we'll dig deeper and we'll be able to address some of those things that you talked
Other questions? Yes.
So I have, I can see that there's a black asset map already, but it seems like this project now it's getting into something else. And in what part of the getting to the policies being written are we? Has Crescent Hill already had these questionnaires, these surveys door to door being done?
We will administer the surveys door to door, hopefully 8 weeks commencing the last week in September through, I think, the week before Thanksgiving. And it's going to be, student and neighborhood resident led.
So we're still in the process of developing and applying the
Okay.
intervention.
Yeah, right now, what we did was we developed the questions. We had the IRB approved through the University of Louisville. We developed the questions from the questions that we had used earlier in Harwood and Limerick neighborhood. However, we're going to take these questions now to neighborhood residents to find out, do they even work? Do they even make sense? And so we're kind of building them through the neighborhood residents right now.
Okay, so we're, just to cut this short, we have a date when study closes so that those policy concerns. But if not, just get back.
Okay, we're looking at the final closing, October 2024. We hope to have something before then. That's the span of the grant. Thank you all very much. Did you have anything you need to add, Ted?
All righty, let's move on, along our agenda. Get back here to appreciate it. Okay, now, just to let you know that the October meeting here will be virtual. Because I could not get the room, sorry, booked. So that's where we are. And let's move on to Madam Dia, as I call her, Deputy Mayor.
Thank you, Chair. And just want to share really 2 updates because I know both Dr. Single and Taylor have lots to update from the political side. From the mayor's office, I would say, just to give everyone an update on our community care campus, we were fortunate to get several really strong proposals for the site there at 225 East Breckenridge. We are in the process of scoring the proposals this week, so we will hopefully have some really strong front runners and make advances both in the way of both medical respite for the site, in addition to what we believe will be a minimum daily shelter. The second piece I wanted to share is that the mayor's office is working on a mental health pilot project. It would involve a multidisciplinary group to identify our top utilizers of the system, folks who are chronically cycling in and out of corrections and hospitalization, psychiatric hospitalization, with the goal to really be able to better understand and maybe come up with some individualized plans for those community members, in addition to be able to draw out some trends within the community with the goal of being able to say, what is it that local government can do in the way of intervention? And so we're really excited about that work. And if anybody has suggestions.
100 feet, turn left onto South First Street.
If anybody has suggestions or ways they want to contribute, please let us know. We certainly see the value and recognize that there's probably lots to build on in this area. This is a new idea. So those are the two updates from the mayor's office.
Let's go, Jason. Yes.
Two pieces of the JCP. I know, I don't want to steal the thunder of what Dr. Single will update on. I do know that the health department has been doing some work with JCPS in the way of vaccines and vaccinations, looking to be able to expand, and folks can provide the update on that. The second piece is really around asthma. And while I was on that paddle this weekend, I got some information and did not realize that while I guess and stop me if I'm saying this wrong, historically, asthma has been the second factor in absences in students, and that recently has decreased. And so I know the mayor is interested in learning more about that, what those contributing factors are, and ways that Metro can support. So perhaps that would be a future topic of interest.
Questions for Madam DM?
I would just say, as far as the mental health piece, I know we have a really good resource with NAMI in Louisville, and they are kind of clubbed in as far as just mental health resources go. I think that they've in the past worked with LMPD, because they do have kind of like special response training and things like that for those people. And I would also imagine LMPD is going to be crucial in telling you your repeat visitors are.
And would you share what NOMI?
NAMI, oh goodness.
It's National
Association of
National
Mental Health.
Alliance Mental Illness, yes.
Okay.
If you have suggestions, folks, as you know, we have such a number of houses who have CIT efforts historically. On about all the opportunities. And again, there had been some work done, I believe, prior to COVID, so none of this is new or revolutionary, but we do want to put out.
Very good. Dr. Single.
Hi, everyone. Sorry I had to leave. So couple of updates and need your comments on this. We're still sort of struggling with JCPS immunization. We're still trying to figure out how can we bridge this gap. There are 1 in 5 students at JCPS who are either not fully immunized or not immunized at all. So that's one thing I would like to open for discussion and get comments or it doesn't have to be in this setting. If anyone wants to approach us, we're open to it, listening to any ideas, any thoughts. And the other update we have is with help of some groups, local groups, UFL and Kentucky Mental Health Department, we are doing a suicide prevention database sort of collection so we can get ahead and figure out what's going on, what's happening, why, so we can implement policies and work on policies to prevent these unnecessary loss of lives.
Questions for Dr. Single?
Or comments?
Comments? Help?
Help?
It's very, no. It's assistance in getting vaccinated. Margulis is off the bandwagon to try to tell people to get vaccinated. I won't tell you what my response now is, but other than you can lead a horse to water, but you can't make him drink. Or as I say, you can lead a horse to disco, but you can't make him dance.
So a quick comment to that. We have done a subgroup analysis or zip code analysis. So I don't think the majority of these people are anti-vaxxers. majority of these people are in zip codes where I believe accessibility is a bigger issue than the sentiments against vaccines.
Well, the issue that, that I would add to that is, and we've had that since COVID. And quite frankly, there's a pharmacy on every corner in this community, and the pharmacist's daughter. So that's what I would say there. I think it's a matter of choice, and if people choose to go without vaccination, then that's a choice that they make, and there are consequences with every decision that each of us as individuals make. But I appreciate your bringing that up, Dr. Single, and I just want folks to know that the learnings out of COVID are that the access is there in nearly every place, given pharmacy locations. So for what it's worth. Thank you, though, for bringing that forward, because I think it's.
Thank you.
Dr. Singal, if I may comment, I think JCPS has seen an improvement in immunizations due to the, PFC and 317.
Vaccine for kids.
Vaccine for kids and 317 programs that they have added to their, all their tools. And I think what has helped JCPS numbers is having all these vaccination clinics, particularly on weekends, on schools that are close to the neighborhoods where all these families live, because we have to keep in mind it's all the barriers that all these families are encountering is transportation for many migrants and refugees, language, trusting, not being able to take hours off their working schedule to their kids to vaccination or themselves. So with JCPS offering vaccines for kids and for adults, I think we are doing a good, positive change, but we may need to start working in collaboration with JCPS, Louisville Metropolitan Health and Wellness, and other organizations so we can promote more and then help all these communities that have had a really hard access to immunizations to get them. Because even if we have pharmacists close by, if parents have troubles trusting, it'll be easier going to school with the people that they already know.
Yeah, thank you. Thank you.
Thank you.
Okay.
Can I just,
Yes.
really quickly. I guess two pieces to this. I mean, first of all, hear me say, this is not really a JCPS issue. This is a community issue, and I certainly recognize that. But I also recognize that there's probably been a switch in practice, meaning, when I worked in child welfare, there was the expectation that your child be vaccinated, or they had to do a demonstration, right, that said they had a religious or philosophical right. And so I think that switch in philosophy or switch in practice has occurred, which does not necessarily require that parent to then have to do that for their child to be in school. Is that correct?
It hasn't changed. It's that they just
They're
have
just
to.
not implemented.
Yeah.
Okay.
Yeah.
And so are we offering vaccines to children in school on site?
I think JCPS is doing it on
some.
a specific clinics. They have a specific vaccination clinics. They do.
Okay. So
Not on a regular, not every
Not
day
just,
that I'm
it's
aware.
like
Yeah.
Tuesday, be like, I need my vaccines today, and the school nurse will do it. It's
No.
their coordinated, planned efforts. And JCPS nurses are amazing. Let's just say that out loud. They've been working really hard since COVID and before to make sure that the vaccines are available. But it's usually looking like clinics. So they've really been able to increase the number of clinics and the number of vaccines that they have available for the communities. But they are coordinated, like designated times and days outside of school hours usually. They have had a few, I know, not a few, but they did have like a concerted effort to have maybe right after school so that the parents could be there if they needed to be. but as far as I know, I don't think I don't know if Angela's on the call, but as far as I know, I don't think they do them
Yeah,
like
I've
during the
asked,
school day, during.
I've asked the school, JCPS to be on these calls because I think it's critical. So, yes.
But in the long run, that's the goal, to
Yeah,
have the
It's
vaccines.
choice.
Because that's
It's choice, dear. It's choice.
Right, but I'm
A
an
lot of
advocate.
it is, but.
I'm an advocate of making things as easy as possible to nudge people, and which brings me to my last question, and this is probably an ethics issue, but I'm gonna ask it anyway. Provided we are fully communicating with everyone, and I recognize there are lots of language barriers, is there ever the discussion, or is it ever possible to essentially, the default is that everyone gets their vaccines and you have to sign to say you don't want your child to have the vaccine? So essentially the nudge principle of like insurance, like can that apply to vaccines, or is there some sort of legislation or regulation that says no?
There is political impact of doing
Yeah,
such.
legally.
Yeah,
From a
there's
health
legally
perspective.
nothing, because when I was in school 1,000 years ago, that's what the requirement was, but this is political.
And I think unique to Louisville, we have to speak to our immigrant populations. So very uniquely, especially to like, very concentrated areas of Louisville, we do have very large, and I mean, I'm a practicing community pharmacist, so like I can say anecdotally, I see where people come in and literally will let me give them as many vaccines as possible, right? So there's definitely an effort to get everybody up to date, but with the record keeping and things like that. So there's the language barrier, there's the access issue, and then there's also, I think, just maybe a disconnect with like, well, what do I need? What do I have to have? And in the interim of trying to get all of these things, the goal is to not keep the children from being able to go to school.
Thank you.
This is Bart. I'd like to mention that we had Family Health Centers conducted a concerted effort to do outreach in communities for persons who are non-English speaking in early spring, along with the Kentucky Nurses Association, Americana Community Center. I'd be happy, I don't have the report in front of me, but I'd be happy to come back to show you what the success rate was for persons with limited English speaking for vaccinations.
That's fine, and if you'll get information to me, I will get it out to the board. Let's move on. And 3 minutes or so, and I don't know, Dr. Irwin, Ms. Shoemaker, for Family Health Centers.
I'll let Ashley go first. Ashley, are you with us today?
So we, our Outreach and Enrollment Coalition met last month to discuss the Medicaid renewals. The state is seeing significant people falling off of Medicaid, largely due to procedural reasons. It's due to not submitting paperwork. I think it's around 47% of terminations are due to procedural reasons. What we're hearing from connectors in the field and other community partners is that in a lot of situations, it's not that people are choosing not to respond. It's that maybe they are responding, but the documents are not the right documents, or we're encountering technical issues. So we are following up with the state on a case-by-case basis when we see people that have been terminated incorrectly. And people should also know that they can re-enroll in coverage and have coverage backdated up to 90 days. So if they do lose coverage, it can be reinstated. But our next meeting is scheduled for October 9th at 4 o'clock. It will be a virtual meeting. Yes.
Are you seeing the drop off more at what areas of the city are you seeing that drop off?
So the state has not released county level data. So we have been asking for that since the unwinding began back in May. They keep saying it's coming. So as soon as we get local, information for Jefferson County, I'll share that.
Heidi, if I may, I'd like to report on a couple grants that Family Health Centers has obtained since we last met. We were successful in getting $400,000 for 3 years in a competitive HRSA grant that will assist us in outreach to persons who are at risk for HIV. and assist them in getting coordinated care. So that's good news. Also, we were successful in getting an early childhood development grant for $200,000 per year for 2 years. And we will assist in getting kids in for well child checks and intervening with families who have kids that have more severe problems, and we'll conduct screenings as well. And finally, we've been concerned about with the COVID vaccinations now costing people. Happy to say we received a $125,000 grant from HRSA yesterday to assure that the uninsured can be vaccinated if they so choose.
And that would be good to get out. Thank you for that. That would be to people who are attending, get that message out to your networks, et cetera. And because that's a great service. Appreciate that. And any other questions? Quickly. Okay, so new business items come
I'd like to
next.
report
Yes, please.
on the GLMS as well as KMA. GLMS has taken a break over the last month in preparation for the KMA annual convention, which was held August 25th through the 27th. And the theme for the meeting was rejuvenating medicine. And GLMS represents the largest contingency for the state of Kentucky. In our caucus, we put forth several resolutions in support of common sense gun laws. And also the other hot topic, obviously, was abortion and the laws pertaining to that in the state of Kentucky, the strictness of those laws and how it's affecting physicians who particularly practice in those areas, OBGYN in particular. There's a challenge around the state in actually getting adequate training done for OBGYN residents. There's a concern about actually meeting quotas in regards to getting residency slots filled. And there are actually physicians leaving the state of Kentucky and going elsewhere. As a state, we cannot afford to lose physicians in our state, particularly in the underserved areas. And so we heard the talk earlier about neighborhoods in Kentucky. We had some very good CME and discussions on the social determinants of health. Obviously it affects Louisville and around the state of Kentucky. The zip code determines your health well-being. And so we also had a change, obviously, in the leadership for the state of Kentucky. And but a very good meeting. Jefferson County very well represented in the meeting itself. I think we got a lot accomplished in regards to putting our agenda for legislators to consider. Yeah, a lot of challenges moving forward. Moving to the state of Kentucky. Common sense laws and things done in that state level will continue to work there. So I mentioned with Washington continue. So
Thank you so much. Yes.
Where do we go to find those recommendations? Like, where
it
does
should
that-
be.
Can you forward them?
I'll check with our leadership in GLMS back to those.
Yes, thank you. Thank you. All right. Any advisory board member updates? Yes.
From the Immunizations Advocacy Committee, we are getting new co-chairs for the Immunizations Advocacy Committee. Thank you so much to Dr. Eccles that has been serving as a co-chair along with me. And now we are welcoming Dr. Ruth Carrico and Dr. Anna Wang as co-chairs for the Immunizations Advocacy Committee.
Dr. Daltisa Cervera is doing a great job, and those are wonderful, wonderful co-chairs, and look forward to what they produce. Any other new business from board members? It is so good to be in person. This is like surreal. I want to thank you for your engagement. And if not, Yes.
think one last announcement regarding public health and the healthy neighborhoods. There is a summit, the People Summit on Food Systems and Urban Agriculture, all aim to help people to grow their own food, even in their own
I
backyards.
believe you shared it.
Yeah, this is sponsored by Food in Neighborhoods and the Kentucky State University Cooperative Extension, and it's gonna happen this Friday and Saturday, so it's gonna be very interesting. I signed up, but I won't be able to be there. Need to go to Boston to my kids, so, but it sounds really interesting because now they are focusing on neighborhoods on the west side, but also on the neighborhoods with new Louisvillians, immigrants and refugees, and they are trying to find what is best for them and find out so we can, all of us, benefit from what they see and what they're doing.
Very good. Anything else? Announcement?
If I may, I just want to introduce myself.
Please.
My
Sorry.
name is Maria Marta Sanchez. I'm a certified healthcare interpreter. I also have a business, which is language services and notary and such like. I live in the Okalona area, 40218, those areas. So as I've said before, I live among the people that I serve. So I do have a lot of insight as to, especially the Hispanic community. And so later on, as I get a little bit more comfortable, I will share. And I know Doctora Patricia from La Casita, and I do volunteer. I also am part of the staff over at Gildas.
Very much so.
And so I'm also, I'm doing the outreach as well there. I do have a lot of information in regards to.
Her certification is a
Healthcare interpreter.
interpreter.
CCHI.
It's phenomenal. So for those of you in your networks, it should be a valuable resource. Okay. Thank you.
Do you have a card?
Can you, I think I can.
I can send my information. Yeah, email. How much you give me?
Okay,
Can I just make one last comment?
please, very quickly.
We are seeing an uptick in polio hospitals. I see that. So suggest gatherings now to mask up.
Yes. Thank you for that.
Yes.
Appreciate that. There is a doctor in the house, other than public health doctors.
But I have done that recommendation in Spanish to our community and in MAM to another part of our community. There's an update, and if we're in big meetings, we should be wearing a mask.
It's the season. Pardon me?
Yeah.
Like to see what strains of COVID, are we still doing that?
Yes, but it's not as
Well,
often.
no, we are not. We are not. We are not. And, yeah, and that's ARPA money. And, I'm not a person who believes what the media tells me and what press releases say, but, evidently the strain, is a milder strain than the community has. That's what they say. I don't know.
Admissions with COVID is up.
Yes,
ICUs is low.
yes.
So,
Thank
so acuity is, you're right. I mean, it's not to say there's not a lot of COVID in the community, there's a lot of COVID in the community, but there's not an ICU.
Just for clarity though, so we're not, in terms of wastewater monitoring, we're not monitoring COVID, we are monitoring.
We are monitoring COVID, we're not sequencing it.
Okay.
Meaning we don't know which variants. So we used to aggressively sequence everything we found. So we could say what the mix was of the different variants. Right now, because acuity is low, CDC has not advised any state to genomic spreads.
So
So
we
if
should
we
know.
get a strain that's dangerous, the state will reinvoke that system. We will start sequencing it. So that's the problem.
So what you should know, though, is that through wastewater testing, which is the reason for funding this effort through the department is because this is the testing for anything that swims around. That was scientific, I'm sure.
Yeah.
That swims around in our wastewater. So early warning is a warning. We're at our time. So any final comments? Any recommendations to the chair? And you know, I always want recommendations on speakers. I'm not a speakers bureau. But I certainly welcome anyone you hear in the interim. And with that, if there are no objections, I will entertain a motion to adjourn. This meeting is adjourned. It is about 9:15. And what I want to thank you for is being here. And I want to thank Arlena.
Yes, thank you, Arlene.